Good morning. Welcome to Focus on the Valley, a public affairs presentation of Midwest Communications. I'm Danny Wayne, the host of the show. Today's show produced by Lauren and engineered by Lauren. She'll make the interviews available online as a podcast at WIBQAM.com. Click on Media, Podcast, and Focus on the Valley. If you have a suggested interview, an organization you'd like for us to feature on the show, or an issue you'd like for us to research, my email address is danny.wayne@mwcradio.com. My guest in the studio is Jane Furry from Paris Community Hospital. Jane, good morning.
Good morning.
Jane, you work a lot with seniors and have been involved with the healthcare industry for a number of years. Give me kind of a little bit of history about you.
I started at Paris Hospital, I believe, in 1985 and worked a few years on med-surg unit and continued my education at Indiana State, where I got my bachelor's degree in nursing. I've taught psychiatric nursing. Seems like everything was pulling me toward behavioral health. So ultimately, when this job came available, I was really interested. So I left being a school nurse with adolescents, which I really liked, and ended up on the geriatric side the last few years.
And that's important because of the aging trend, and we're going to talk about some statistics in just a few minutes, but give me a little bit of an idea of how Paris Community Hospital reaches out to seniors that are cognitively challenged.
Well, usually a doctor, their doctor will be the first one that may make a referral or talk to the family about contacting us. We don't need a referral, so your clergyman might be a person that could do that. A neighbor. We've had best friends come in with their friend that's having some problems and noticing that they're slipping. Nursing homes call us. So anywhere where there's someone that, is beginning to slip a little, someone out there will get the name to us and we'll go from there.
It sounds like you can begin services pretty quick. It doesn't have to be a lot of paperwork and a lot of referrals sent back and forth. It sounds like you can be involved in the family's well-being pretty quick.
Pretty quick. It's based on, it's a Medicare program, so we have to follow Medicare guidelines. We have to do a pretty good assessment on them to see how cognitively intact they still are. A lot of people think, this is where you play games, put together puzzles, and that's not it at all. This is intensive outpatient therapy with counselors, with therapists. We have 2 social workers that work. They're both LCSW, and they've been there 5 years almost since we opened. What we do is we make sure they fit the criteria. Once they do, I contact our medical director and say, I've got an admission set up for you, and we get them in on a Friday. That's doctor day, so all admissions happen on a Friday. You can start group then or wait until the following Monday to start with the group.
And can we talk a little bit about the program, what families can expect their loved one will experience at Paris Community Hospital under this umbrella?
Okay. We're located off campus. We're not there at the hospital. We're right on Route 150 coming from Terre Haute before you get to Walmart in the a strip mall that has Dollar General by Wendy's. So it's off campus. They come anywhere. The patient will be brought to us about 9:30 in the morning. Some of them still drive. A lot of our patients are still drivers. Some have their families bring them. We have a contract with the mass transit there in Paris, and we take care of that, picking them up door to door and taking them home back to the door. I guess otherwise, if they're in a nursing home, the nursing homes bring them. We take their vital signs right off the bat. They have coffee and a light breakfast. Go into a group room. Then group starts right at 9. That goes on till about 11:30. They take breaks in between. They don't have to sit there the whole time. They're up and down and in and out the door. Then we have lunch together. That's kind of a highlight for a lot of these folks.
Social.
Yes. The social part of it is great. And we sit in there with them. They learn about our families. It's more of a, let's just kind of all be down to earth. Our meals are catered from Main Street there in Paris. The clients pick out their own meals, so they always get what they like. And then we do one more group after lunch. I wind it up with a little nursing group that I think the last one I did had something to do with healthy foods to help improve your mood. And that was, people were even taking notes on that one. Then you're off. The bus comes back, the family comes back, everybody says their farewells and come back the next Wednesday.
So you do this once a week then?
We do this Monday, Wednesdays, and Fridays.
Okay, 3 days a week. It's
Yes.
a great opportunity, and I can see many situations, as you and I both know, you don't want someone who is having a little bit of some cognitive challenges to be at home alone. And 3 days a week, the interaction is probably beneficial to stimulate their ability to still be active.
That's exactly right. We'll often take folks that we're just not sure they are going to be able to do this, but I write the order so that it is saying we'll give a trial period to see if the cognitive stimulation of groups and with others will improve their mental capacity, and usually it does.
As we talk about that, I really hate to do this, but do you have some numbers that kind of give us some feedback of what you have found? Obviously, it's driven by healthcare, so you got to produce a statistic.
Sure. Like I said, we've been open. We're finishing our 6th year. In those 6 years, we've had about 408 referrals. Now, all those referrals don't turn into admissions. It can either be they don't score high enough on some of the cognitive tests because, we can't have them there if they can't be up to level with everyone else. It could be their insurance. Their insurance has to be Medicare primary. A lot of the new Advantage plans and supplemental plans, if they're the patient's primary, we can accept them. So we're kind of training our folks in the area that these seniors that think they're getting a really good insurance, when it doesn't cover Part B, things like outpatient, it's not good for them. And
we don't know that until we start to investigate it. So by you being on the radio talking about this, it's wonderful. It gives us an idea. My guest is Jane Furry, Paris Community Hospital. Jane, I don't want to run out of time here. How do we get in touch with you, and what's the process to maybe introduce my family member to this program?
Okay. Just give us a call. You can call the Paris Hospital number, and they will transfer you to us. Our number is 217-465-2606, extension 170, and that'll get you straight to senior care. All
right, senior care. My guest is Jane Furry. Jane, we're almost out of time. Is there a minute, less than a minute, you've got something you want to share with us? This time of the year, depression sets in for holidays.
Yes, it does. The memories of the holidays, as we all know, can be sweet memories or not so. These folks have suffered a lot of losses, loss of independence, loss of their loved ones, loss of their home, their health. They get sad, and when they're with us, you hear lots of laughter. It's hard sometimes to remember that these folks are depressed. We become a tight family.
It really sounds like a great opportunity for families and individuals, whether it be the clergy, your next-door neighbor, or you as a daughter or son. This is a great opportunity in Paris, and the program, again, is called
Senior Care
through the Paris Community Hospital. Monday, Wednesday, and Friday. It's a great opportunity. Jane, thank you very much for taking time to come by. Will you come back and give us an update on what's going on with the program?
Oh, I certainly will.
All right. Jane Furry with Paris Community Hospital with the senior program, giving you an idea. It's 217-465-2606. And Jane, the extension again is
170.
Thank you very much. Focus on the Valley is produced by Lauren. It's a public affairs presentation of Midwest Communication.